What you believe about pain, damage, and safety influences how you move, how much you trust your body, and how willing you are to participate in rehabilitation. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle, and this is episode 37, part 2 of our conversation on preparing for knee replacement surgery. And this episode is also entirely focused on the pre-surgery phase. If you haven't listened to episode 36 yet, I recommend starting there. These two episodes are designed to work together, not as a checklist and not as a set of rules, but as a way to reduce pressure and help you focus your energy where it actually helps. In part 1, we talked about the foundations that consistently shape recovery. Today, we're talking about what carries less weight than people are often led to believe, and the less obvious factors that still influence outcomes before surgery. By the end of this episode, you'll have a clearer sense of which common concerns deserve a little less of your attention, how expectations and access shape readiness, and how to move forward feeling more grounded rather than pressured. Imaging is often given more importance than it deserves in day-to-day decision-making. X-rays and MRIs are essential for surgeons when planning a knee replacement, but they do not reliably predict how much pain you'll feel, how well you function, or how ready you are for surgery. Many people are surprised to learn that severe arthritis on imaging often coexists with reasonable daily function, while others with milder findings struggle significantly. This disconnect can create unnecessary fear. Over the years, I've had many patients tell me that their surgeon looked at their imaging and said something like, "This is one of the worst knees I've ever seen." I don't know whether that was hyperbole in the moment, a reflection of how striking the images looked, or simply how the message landed for the patient. But what I do know is how often that comment stayed with them. When images are framed as proof of damage or decline, people often become more cautious, move less, and lose confidence in their body. Research has shown for years that the severity of arthritis seen on imaging does not reliably predict pain or day-to-day function, which is one reason those kinds of comments can feel so unsettling when they're taken at face value. What tends to reflect readiness far better than pictures is how you move through your day, how far you can walk, how easily you can stand up, how confident you feel using stairs, and how much knee pain limits your choices. Those lived experiences provide information that imaging alone simply cannot. Body weight is another area where fear often overshadows nuance. Weight can influence surgical risk, and it should always be discussed openly with your surgeon. But success after knee replacement is not determined by reaching a single number on a scale. Research has shown that while higher body weight can influence surgical risk, it does not reliably predict pain relief or functional improvement after knee replacement. Improvements in strength, cardiovascular tolerance, and metabolic health often influence recovery more meaningfully than rapid weight loss before surgery. For many people, aggressive dieting before surgery increases stress, fatigue, and muscle loss, which is not an unusual response under pressure. Those changes can leave you less prepared rather than more prepared. Gradual changes that support strength, blood sugar control, and daily activity tend to be more protective than short-term attempts to force weight change during an already demanding time. Assistive devices and recovery equipment play an important role in early recovery and are often essential for safety, balance, and restoring a more normal walking pattern. Walkers, canes, braces, ice machines, and home supports can protect the joint, support balance, and improve comfort in the early days after surgery, and they work best when paired with the physical capacity you bring into surgery. This distinction is important because many people feel productive when they're organizing their home or gathering equipment, even while postponing movement or physical preparation. And planning ahead is useful and often necessary, but these supports are most effective when they support movement, strength, and gradual exposure rather than standing in for them. Equipment helps you recover more safely and confidently, It supports movement and balance, even though it does not create strength or endurance on its own. How people use that support, however, is shaped by what they expect their body is capable of. Expectations shape recovery through behavior. What you believe about pain, damage, and safety influences how you move, how much you trust your body, and how willing you are to participate in rehabilitation. If pain is interpreted as danger, movement often becomes more cautious and limited. This is a very human response and is very natural, especially when pain has been present for a long time. When pain is understood as part of a healing and adaptation, movement tends to continue with appropriate modification. And that difference may sound subtle, but it has meaningful consequences over the long term. Research on musculoskeletal education consistently shows that these beliefs influence how people prepare for and engage in recovery after knee replacement. A 2022 study published in the Journal of Orthopedic and Sports Physical Therapy by Goff and colleagues highlighted how physical therapists prioritize correcting the belief that pain automatically equals harm, because avoidance reliably leads to deconditioning, unfortunately. Education does not eliminate discomfort, but it often changes how people respond to it. So that education is quite important. Differences in people's circumstances shape the situation they're starting from, for sure, but they don't determine how well someone can recover. A 2025 scoping review by Aldawani and colleagues examined U.S. studies on short-term outcomes after hip and knee arthroplasty and found mixed results depending on population and outcome measures. And these differences are often tied to access to care, transportation, financial resources, and social support, not a person's inherent ability to recover. And understanding this distinction helps explain why it shifts the focus from personal blame to practical problem solving. When barriers are identified early and support systems are strengthened, outcomes often improve across very different populations. Context is what's shaping that opportunity, not potential. Access and support play a meaningful role before surgery. Not everyone has the same availability of in-person physical therapy, flexible work schedules, reliable transportation, or even help at home. And these factors influence how consistently people can prepare and how smoothly they transition into recovery. Another study, a 2025 randomized controlled trial by White and colleagues, demonstrated that structured telehealth physical therapy interventions can successfully increase physical activity in people with knee osteoarthritis. And this reinforces that high-quality guidance does not depend on a single delivery format. So don't beat yourself up about that. If you can't get into physical therapy, maybe you have the opportunity to do some telehealth visits. Flexible models can reduce barriers and extend support to people who would otherwise struggle to access that care. Here's another topic, and it's chronic health conditions. Chronic health conditions can influence healing and adaptation, which is one reason why there is benefit from preparation being individualized rather than standardized. For some people, progress happens more gradually, and planning that respects overall health tends to be more protective than pushing timelines that really don't fit the body. Across all of this, consistency remains the common thread. Not perfect habits, not extreme plans, but steady engagement before surgery that fits your life, your health, and your capacity. Preparation is not about doing more and more. It's about doing the right things that support you over time. So, a brief reminder as we wrap up, this podcast is for education, not individualized medical advice, and your surgeon and physical therapist will provide care and guidance tailored to your individual health and circumstances. If you want clear, realistic education about how to prepare before knee replacement surgery, my upcoming book, The Knee Replacement Game Plan, focuses exclusively on the pre-surgery phase. It clarifies what tends to support preparation and what often adds unnecessary pressure. And it mirrors the research-driven priorities we've discussed across these last two episodes, episodes 36 and 37. You can find more information about the upcoming release at totalkneesuccess.com. If you'd like to be notified when the book is released, you can join the email list linked in the show notes. So in the next episode, episode 38, we'll shift into a different but related conversation about how knee arthritis changes how your body feels and moves long before surgery. I'm Michelle. Thanks for joining me, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.